Hello everyone, welcome to my YouTube channel Pharma Researcher. So this video is going to be the English version or English explanation of the last video that I have uploaded in this YouTube channel regarding JIPMER previous year question paper, that is of pharmacist, and that was held in the year 2014. So let's start with the first question. So the question is, which one of the drugs is least likely to cause electrolyte imbalance? So we have to find among these four drugs which is which will cause the least electrolyte imbalance or will not be responsible in electrolyte imbalance. So first let us understand about the electrolyte imbalance. Then we will say that a person is suffering from electrolyte imbalance. So there are certain electrolytes that are required in the body to perform several functions. So they are required in a range like 5 to 6 moles or 5 to 6 milli equivalents per liter. So like in this range, so if they decreases from this range or increases from this range, then there is a condition arises that is called electrolyte imbalance. So there are different electrolytes, like if I'll talk about calcium, then potassium, then magnesium, then sodium and chloride. So these are several electrolytes that are responsible to perform several different functions. So I'll discuss different functions of these electrolytes. First I'll talk about calcium. So calcium is mainly help with muscle contractions, nerve signaling, blood clotting, cell division, bones and teeth formation. So calcium is required in the range 5 to 5.5 milli equivalents per liter. Then I'll talk about potassium. So potassium is mainly responsible to keep blood pressure levels stable, regulates heart contractions and helps with muscle functions, and it is required in the range 5 to 5 milli equivalents per liter. Then if I'll talk about magnesium, then magnesium is mainly needed for muscle contraction to for the proper heart rhythms, nerve functioning, bone building and strength. It also reduces the anxiety and digestion, and stable protein fluid balance is are also the functions of magnesium. So it is required in the range 1.5 to 2.5 per liter. Then if I'll talk about sodium, so sodium is mainly helps in maintaining the fluid balance, and it is needed for muscle contractions and also helps with nerve signaling, and it is required in the body in the range 136 to 145 milli equivalents per liter. Then I'll talk about chlorine. So chloride, it mainly maintains the fluid balance in the body and required in the range 97 to 107 milli equivalents per liter. So these ranges can be varied from book to book. So now coming to this question, that among these, which one will be least likely to cause the electrolyte imbalance? So if I'll talk about the first one, that is sodium bicarbonate, we will get the sodium electrolyte from this, and it will perform the same function that I have mentioned in the sodium electrolyte. So it can cause the electrolyte imbalance. Then talk about potassium chloride. So in potassium chloride we will get potassium and chloride, so they can perform their specific functions. Then from aluminum hydroxide we will not get any specific electrolyte that is mainly responsible for electrolyte imbalance. So for this question the answer is option number C. And if I'll talk about sodium chloride, then we will get sodium and chloride, these electrolytes, and they perform their functions like in maintaining the fluid balance or muscle contractions or nerve signaling. So for this question, option C is correct. That is, among these four, aluminum hydroxide will be the least likely to cause the electrolyte imbalance. Now coming to next question. So next question is, which one should carry a label "Do not freeze"? So among these four drugs or dosage forms, which one will carry a label containing do not freeze? So among these, the option number B, that is ampicillin syrup, it will contain the label that is do not freeze. Now talk about the other ones, that is chlorpromazine syrup. So it will contain a label like do not store above 25 degrees Celsius or protect from light. Then if I'll talk about cotrimoxazole suspension, so it will contain a label like store in cool, dry place having temperature 15 to 30 degrees Celsius, 15 to 30 degree Celsius. Then if I'll talk about cephalosporin suspension, so it will contain a label like store in ambient, refrigerated and frozen conditions. So the answer is option B for this question. Now we will move to the next question. So the next question is, which one will show non-linear pharmacokinetics? So among these four drugs, which one will show the non-linear pharmacokinetics? First, we will understand what is linear pharmacokinetics and what is non-linear. So in linear pharmacokinetics, when we increase the dose of a drug, the pharmacokinetic factors will increase or decrease with respect to that. But in some cases, in some drugs, it is observed that when we are increases the dose or when we are using medication for a long time, it will cause deviation from a linear pharmacokinetic profile. And due to this reason, it is also called dose dependent kinetics. Dose dependent kinetics. So there are different causes of non-linearity due to which we will be facing the non-linear pharmacokinetics. So these causes are, if I'll say, first is drug absorption, then drug distribution, then drug metabolism, and drug excretion. So these are the main four causes that are responsible for non-linearity. Now different drugs falls in these causes that I will discuss here. So if I'll talk about drug absorption, so different drugs which causes non-linearity due to drug absorption, they include griseofulvin, riboflavin, ascorbic acid, and propranolol. So these are the different drugs that will cause non-linear pharmacokinetics due to drug absorption. Then if I'll talk about drug distribution, then different drugs that cause non-linearity due to drug distribution will include phenylbutazone, imipramine. Okay, then due to drug metabolism, the drugs will include phenytoin, theophylline, alcohol, and carbamazepine. Then if I'll talk about drug excretion, so drugs that will comes under drug excretion that are causing non-linearity include penicillin, water soluble vitamins, and also glucose will show the non-linearity due to drug excretion. So among these drugs, the phenytoin will show non-linear pharmacokinetics due to drug metabolism. So it is mainly due to capacity limited metabolism that will due to the enzyme or cofactor saturation. So option A is correct for this question. The next question is, the antibacterial activity of phenol is increased by. So why, which factor the activity antibacterial activity of phenol will be increased, that we have to tell. So when we will see a rise in temperature of phenol, then the antibacterial activity of the phenol will be increased. So option D is correct for this question. Then next question is, early symptom of aspirin poisoning is. So there are different symptoms that are observed due to aspirin poisoning. One is early symptoms and others are late symptoms. So in early symptoms, we will be getting the ringing in ears. So option D is correct. And in late symptoms, these three and several other symptoms may also include, but these are the main. So skin rash, fluid retention, throbbing, headache. So these will be comes under late symptoms. So option D is correct for this question. The next question is, intestinal perforation in ulcerative colitis occurs with. So first we will understand what is intestinal perforation in ulcerative colitis. So it is a, we can say it is a serious complication or maybe potentially fatal complication of inflammatory bowel disease. So it can be observed by the use of. So option C is correct for this question. The next question is, how many millimoles of potassium are there in 500 mg of potassium chloride? So in order to find the millimoles or mgs, we use a simple formula, that is millimole is equal to mg divided by molecular weight. So here we are getting the mgs and we are getting the compound potassium chloride, through which we can find out the molecular weight. So mg are 500 and the molecular weight of potassium chloride is 74.55 grams per mole. So by simply dividing this value, we will get the answer 6.7 millimoles. So the correct answer will be option A, that is 6.7 millimoles of potassium are there in 500 mg of potassium chloride. Then we will move to the next question. So the next question is, what is major contraindication for use of over-the-counter medications containing sympathomimetic drugs? So we have to find out the contraindication in which sympathomimetic drugs should not be given. So firstly, I'll tell you about what sympathomimetic drugs will do. So they basically mimic or stimulate the adrenergic nervous system, and they can raise the blood pressure levels. So in case of hypertension, their blood pressure levels are raised to a certain limit that could be dangerous to a person. So it should be contraindicated in this case, in case of hypertension. So option C is correct. And if I'll talk about different sympathomimetic drugs, so it will include ephedrine, tyramine, cocaine, clonidine, dopamine, and several other drugs like terbutaline, isoproterenol, norepinephrine. So these drugs also comes under sympathomimetic drugs. Then move to the next question, that is, which antimalarial drug to be avoided in G6-PDH deficiency? So in this we have to identify the antimalarial drug that should be avoided in G6-PDH deficiency. Firstly, we look at G6-PDH deficiency. So it is glucose 6 phosphate dehydrogenase. Okay. So what this G6-PDH will do, so it simply carries the oxygen from the lungs to tissue throughout the body. So mainly it supply the oxygen to different tissues through in the body, and also it helps to defend the red blood cells against stress. So by the use of primaquine, what primaquine will do? So primaquine damage these cells and leading to acute hemolytic anemia, leading to acute hemolytic anemia. If this enzyme is deficient in the body, so it will not protect the red blood cells from the stress that is given by the primaquine, and it will lead to the acute hemolytic anemia. So that's why this drug should be avoided in case of G6-PDH deficiency. So option C is correct for this question. The next question is, ceproheptidine belongs to which group of drugs? So ceproheptidine is a drug which is a H1 blocker. So it will come under the category antihistamines, specifically H1 blockers. The next question is, which one of the following drugs has anti-inflammatory action? So we have to choose the drug among these four which will be having anti-inflammatory action. So if I'll talk about codeine, so codeine is an opioid analgesic of moderate type. Okay, moderate agonist, and also it has antitussive action, antitussive properties also there in codeine. If I'll talk about pethidine, so it is also opioid analgesic like that of codeine, and it is a phenylpiperidine derivative. Then talk about methadone. So methadone is also a opioid analgesic, and it is a strong opioid. It is a strong opioid analgesic. And if I'll talk about its structural characteristics, so it is a phenylpropylamine derivative. So these first three drugs are the opioid analgesics, and the fourth one, that is meloxicam. So it is a NSAID, non-steroidal anti-inflammatory drug under the category enolic acid derivative, under the category enolic acid derivative, or we can say benzothiazine, or we can say benzothiazine derivative. So option D will be correct, that meloxicam, which is a enolic acid or benzothiazine derivative, will show anti-inflammatory action. The next question is, the antimicrobial action of cephalosporin is, so by which mechanism the cephalosporin will produce the antimicrobial action? So they simply inhibit the cell wall synthesis and produce their antimicrobial action. So the cephalosporins are beta-lactam, beta-lactam antimicrobials, and they are effective against both gram positive and gram negative bacteria. Then we will move to the next question, that is, which one of the following is pharmacological action of histamine? So histamine has different pharmacological actions. So we have to find the correct pharmacological action that is reported here. So if I'll talk about the first option, that is constriction of capillaries. So this is not the pharmacological action of histamine. Rather it dilates, arteries and capillaries. Then I'll talk about reduction of heart rate. So this statement is also wrong. Histamine does not reduce heart rate, rather it increases the heart rate. And then increases gastric acid secretion. So this is the correct statement, that histamine increases the gastric acid secretion. So this statement is correct. And if I'll talk about option D, that is elevation of blood pressure. So this statement is also wrong. Rather it lowers the blood pressure. It lowers or decreases the blood pressure. So option number histamine increases the is correct. And other pharmacological actions that we have learned from this question is it dilates the arteries and capillaries, it lowers the blood pressure, and it increases the heart rate. Then we will move to the next question, that is all of the following products used in the treatment of glaucoma are applied topically except. So there are different drugs that are used, all of these are used against glaucoma, but one of them is not used by the topical route. So we have to identify that one. So if I'll talk about the first option, that is Xelantan. So it is latanoprost. It is latanoprost drug which is applied by ophthalmic route, or we can say topically applied in the form of eye drops, and one drop is given in the eye in the evening time. And if anyone misses a single dose, then he has or they have to start the therapy from the starting. Then if I'll talk about Dimox, so Dimox is simply acetazolamide, and it is given by the route intravenous or intramuscular, IV or IM route. So option B will be correct. That is, this is Diamox, that is acetazolamide, is used in the treatment of glaucoma and not given topically. Rather, it given by intravenous route or intramuscular route. Then if I'll talk about Trusopt, so it is dorzolamide. It is dorzolamide and it is given topically 3 times a day. Then timoptilol, so it is simply timolol and it is also given topically 1 drop a day. So option B will be correct for this question. So let us move to the next question. So next question is all are not true regarding terazosin except. So this statement in the question is somewhat tricky. So they have mentioned that all are not true, means these statement all are not true means these are the false statements except one. Except one, all are the false statement. That means we have to identify the correct statement. We have to simply identify the correct statement among these four regarding the terazosin. So firstly we start with the first statement, that is constrict smooth muscle. So this statement is wrong regarding terazosin. So what terazosin will do? So it is simply an alpha blocker which relaxes the smooth muscle. It relaxes the smooth muscles. The next statement is a selective beta blocker. So that I have explained that it is not a beta blocker, it is a alpha blocker. It is a alpha blocker. Then the third statement is increases urinary flow rate. So this statement is true. Like what terazosin will do? So it simply relaxes the prostate muscles and simply open the bladder. That will ultimately result in increase in urinary flow rate. So this statement is totally correct. Then fourth statement is contraindicated in prostate cancer. So this statement is also false, that it is not contraindicated in prostate cancer. Rather it relaxes the prostate muscles. So option C will be correct for this question. That is, this statement is true regarding terazosin. The next question is dipyridamole is an. So dipyridamole will perform which type of activity and how it will produce, that I will explain in this question. So firstly I will tell dipyridamole is a antiplatelet drug. So option A is correct. So what it will do? So dipyridamole will inhibit the function of phosphodiesterase. Inhibit the functions of phosphodiesterase and adenosine deaminase. So it will inhibit the function of these two important enzymes. And now I'll tell you the function of phosphodiesterase. Phosphodiesterase, PDE. So what they will do, they will simply useful for the conversion of cyclic AMP, that is cyclic adenosine monophosphate, and cyclic GMP, that is cyclic guanine monophosphate, to their non-cyclic equivalent. And this dipyridamole will inhibit the function of this PDE. So option A is correct for this question, and ultimately used as antiplatelet drug. The next question is, all the following combination produces hazardous reaction except, so we have to find the combination that will not produce hazardous reaction. So the combination is progesterone and clindamycin. So this combination will not produce any hazardous reaction, rather the one that is ergotamine and zolmitriptan. So what this combination will do, so the ergotamine if given with zolmitriptan, so it significantly affect the pharmacokinetic of zolmitriptan and also its metabolites. So it will affect the actions of both of these. Then if I'll talk about warfarin and glyclazide, so if they are given along in combination, so there will be a higher risk of hypoglycemia can be observed. And then if I'll talk about captopril and spironolactone, so what they will do, if they are given in combination, they will increase the potassium level. They will increase the potassium level in the blood, and they can cause hyperkalemia. So the non-hazardous combination will be option C, progesterone and clindamycin. The next question is, in order to make a generic substitution, a pharmacist must do which of the following? So if a pharmacist has to make a generic substitution from the prescribed drug, then what condition is to be followed for the pharmacist, that we have to tell. So there are different options, that is notify the patient of the substitution, charge the same or lower price for the generic, place the brand name on the label, and obtain the physician's consent. So the option B and option C are totally not to be followed. So main options will be option A and option D. So in the answer key, the option A was given, that is notify the patient of the substitution. That is totally correct. What there is also one other statement, that is obtain the physician's consent. So I have also read something about this statement, that this statement can also be correct in certain circumstances, but not for all circumstances. So most appropriate answer would be option A, that is notify the patient of the substitution. The next question is, which of the following requires the advisory label warning may cause drowsiness? So among these four drugs, in which drug we will find the label having warning, that is may cause drowsiness? So in the cyclobenzaprine drug, which can cause drowsiness, we will find this label, that is may cause drowsiness. So option C will be correct for this question. The next question is, which of the following statements demonstrates that a patient understands the risk associated with? So among these statements, in which condition doxorubicin should not be given, or we will find the risk that are associated with doxorubicin. So it should not be given in pregnancy because it will cause serious effects in pregnancy. So it should be avoided in pregnancy. Option A will be correct. So that's all for today's video. We will meet in the next video, in which I'll come up with few more questions of the same paper. Around 80 questions are left in this question paper, and I will upload these questions in two parts each. So that's all for this video. So thank you very much for listening.